You're listening to Focus on the Community, brought to you by Harris Regional and Swain Community Hospital. And all week long, we've been talking to Dr. Marshall, who's from the Harris Wound Healing and Hyperbaric Center. Thank you for being here.
Thanks for having me. Appreciate it.
All right. We were talking originally about PAD. So would you explain what PAD is one more time in case people missed it this week?
So PAD is peripheral arterial disease, and it's a condition that people can develop in their legs usually, and it's narrowing of the blood vessels, or more specifically the arteries that deliver blood from the heart to the feet and to the ankles and to the toes.
And a lot of risk factors we went over, which are smoking, high cholesterol, high blood pressure, diabetes, heart disease, obesity, and then family history.
Correct.
Anything that I missed there?
No, I think that's pretty good.
Okay,
Yeah.
good. And we were also talking about the signs and the symptoms. So for those of you that are listening, maybe you're having some pain or some cramping in your feet or in your legs. What do you think they should do first? So maybe somebody's been kind of ignoring this problem and it's starting to become more of a problem. They're having some common signs and symptoms that we've talked about this week. Where should they start? What's the right next move?
I think the best thing to do is probably to be seen by your primary care physician, your family practice doctor. Mm-hmm. The thing, and he or she will be able to do some tests and guide you and check the severity of, if you have peripheral arterial disease. Some of the things that you can do for yourself, if you don't want to go to the family doc yet, maybe you sort of want to stay away from doctors, which I get. If you don't want to do that and you want to stay at home, watching your diet, watching your blood sugars if you have diabetes, mm-hmm. if you're smoking, stopping smoking and stopping all nicotine, because both the tobacco tar and the nicotine clog arteries. So
and that includes the vaping and the Nicorette gum, any of the tobacco products.
Absolutely, yeah. Anything with nicotine or tobacco is going to worsen peripheral arterial disease. So if you can cut that out, that's a huge step. And then just light exercise, even mm-hmm. walking would be great. A lot of people, when they hear exercise, they think that we're going to give them a prescription for, hourly visits
CrossFit.
to the gym. CrossFit, right.
I'm not doing it.
Climb this mountain, yeah. But no, just walking around your neighborhood, taking the dog out for a walk, things like that are really good for helping stave off peripheral arterial disease.
All right, and we appreciate you kind of educating us about this particular disease. I know that the Wound Healing Hyperbaric Center does not only treat patients with PAD, they also treat patients with all different types of wounds. So would you go over some of the type of wounds that we're talking about?
Yeah.
Because sometimes they can be small, but if they've been there for a long time, then they probably need to be seen.
So
go over kind of
out.
who you treat.
Yeah, I think that one of the more common wounds that we treat are people with peripheral arterial disease or PAD, and they'll develop blisters or wounds on their toes or on their feet. Another really common wound that we see is on the legs itself, but it's not from the arteries per se, it's from the veins in your legs. So the veins bring blood from your toes back up to your heart, mm-hmm. and a lot of people who have hypertension or obesity or diabetes or who smoke, same risk factors for PAD, they can develop peripheral venous disease, which is the veins aren't working, the veins aren't bringing the blood back up to your heart, mm-hmm. and they'll develop wounds from that. So we see a lot of those types of patients too. Patients who've had skin cancers, patients who've been burned, patients who have a pressure sore, either from a wheelchair mm-hmm. or a bed, or sometimes they're hospitalized and their feet won't get picked up or moved, and they'll develop pressure sores on their feet. Mm-hmm. So we'll see those types of wounds as well. And then the hyperbaric oxygen component of that, we also can treat people who don't have wounds per se, but maybe they have an internal problem, like from radiation they may have gotten from cancer treatment, and we'll treat those with hyperbaric oxygen.
And one of the things we were talking about the hyperbaric oxygen therapy, you guys have 2 chambers,
Correct.
Which is pretty unique because west of Asheville, over here in Western North Carolina, not everybody has access to this type of treatment.
Correct.
So it's pretty phenomenal that right here in Jackson County, basically right here at Harris Hospital up the road from our station, has this type of therapy for the people in this area. So that's pretty incredible.
Yeah.
And we talked a little bit about your team. Is there anything more you want to say about your team? I know that they are patient advocates, really. They really go after why the wound is there, and you guys are treating the wounds and trying to get to the bottom of it. Is there anything else you want to talk about that happens in your office that maybe we need to know?
No, I just think that a lot of people may be intimidated. Mm-hmm. They're, when you say, "Oh, I'm going to go to a wound care center," that sounds intimidating and mm-hmm. it sounds daunting. And as soon as you walk in the doors, you're gonna feel like you're with family. Some family you like, some family you don't like. We'll be the family you like, hopefully. And we're gonna fight for you and fight for your wound and fight to get you the dressings that you need and that you deserve, and get you everything that you deserve as a human being to help get through this.
And Dr. Marshall, I know that we talked about that you guys take all kinds of insurances.
We take everything. Yep.
And if you have a question, maybe you also take people that self-call and make an appointment. You don't
That's
have to
correct.
have a referral. So we want
That's
to make sure
correct.
that people know that.
Yes.
If there's something that you've been dealing with and you're putting it off and you're thinking you're a man and you're thinking, I don't need to have that looked at or whatever. If it's been there longer than 3 or 4 weeks, they kind of need to give you a call either to their regular doctor. And even if they don't have one, they can come straight to you.
Yes, they can.
And you can call 828-586-7910. That's 828-586-7910. Harris Wounds Healing and Hyperbaric Center is located right there by Harris Hospital. We've been talking to Dr. Marshall all week. You've educated us on pads, so thank you for that.
Thanks for having me.
Absolutely. And it seems like walking is a good idea for all the things.
It's great.
Yeah. It's
Walking's awesome.
Get out there and walk. And if you've
right.
got something, don't ignore the wounds that you have. Or if you have something, maybe they've tried other treatments that have not worked. You have the resources at your center here. You mentioned a few of them earlier in the week, like some skin
substitutes.
Yeah.
We have wound vac treatments. We have lots of different things in our armamentarium to treat wounds that you won't find at a regular family practice
Right.
office.
And so if you're at the end of your journey and you've tried these different things, medicines and doing things yourself and it's not healing, this would be the right next step.
Come see us. Yep.
Absolutely.
Yep.
So you can call 828-586-7910, and that's Harris Wound Healing and Hyperbaric Center. Definitely check them out if you've got a wound that's concerning you. You can talk to your doctor and they can refer you over. You can just call and go in and see. Y'all are warm and friendly and non-scary. I can attest to that this week.
Good. Thanks.
Thank you for being here, Dr.
Thanks
Marshall.
for having me. Appreciate it.
Absolutely. You've been listening to Focus on the Community, brought to you by Harris Regional and Swain Community Hospital. And